Yes. Okay.
Oh, there it is. It's showing us recording now. Perfect.
Okay, awesome. Okay, everyone can see the screen. So I'll be presenting my group project from histology lab this semester. It is focused on novel lemon oil as a biofriendly alternative to silane in histological processing of H&E staining. And I'll be working with Cynthia Luna, Guadalupe Calderon, Claudia Rivas, Tyrese Ham, and our faculty advisor is Dr. Adriana Visbel. Our background on our project with the interest of mine is silane. So silane is used as a standard deparaffинization and clearing steps in histological tissue. Tissue, when it's processed, is embedded in paraffin, so we need some sort of agent to get rid of the paraffin, and the clearing step will dissolve the fat and kind of preserve the tissue. And silane is a standard in histological processing. The issue with silane, though, is that it's an environmental hazard and a health hazard. Aside from being a neurotoxin, a lot of pathologists, when they have long-term exposure to it, develop various health hazards. And it's, of course, an occupational hazard due to the exposure. On top of that, silane waste is very difficult and expensive to dispose of, and it's also an environmental hazard. You can see here it is a hydrocarbon ring with two methyl groups coming off of it in various positions, ortho, meta, and para, and it's a clear liquid. So finding an alternative to silane that is bio-friendly would help decrease the occupational hazard for pathologists and make tissue staining a lot safer. So our research question is focused on, will lemon oil be an effective alternative for silane in the deparaffinization and clearing steps of the hematoxylin and eosin staining procedure? And we just focused on H&E staining before expanding to any other stains. Our experimental design starts with just your standard H&E staining. So just your standard deparaffinization going through H&E and then clearing. And we decided to divide the tissue into 4 different groups. These sample tissues that we focused on were kidney and mammary. So as you can see, there's 4 groups. They differ in the deparaffinization and clearing steps. So for our group A, that it's going to be our control group for silane. We know that this is tried and true. This is the standard. So it uses silane in the deparaffinization and the silane in the clearing step, as compared to group D, which is lemon oil in both the deparaffinization and clearing steps. Group B and C were there as controls to see if the lemon oil would affect deparaffinization or clearing steps in different ways. So as you can see, group B uses silane for deparaffinization and lemon oil for clearing, whereas C uses lemon oil for deparaffinization and silane for clearing. So after going through the standard H&E staining, we would take sample images at various magnifications and compare them using a rubric and blind comparison tests amongst our group members. Our rubric is focused on the qualitative staining by comparing the first cytoplasmic morphology, the uniformity, and the clarity. We defined cytoplasmic morphology as the identification of the nuclei in our tissue samples and how clear it is and easy it is to identify the nuclei. Uniformity would have to do with the distribution of the dye and the contrast of how the hematoxylin and eosin stain the tissue. And clarity would be how clear the overall image of the tissue looks, because if the tissue sample wasn't properly going through the deparaffinization step, it's going to be very difficult to see. And those were the 3 things that we focused on in our tissue samples. So this is the results from group A and group D. we decided to focus on our fully standard control and our experimental group. So these are hematoxylin and eosin staining results for kidney and breast tissue, and it's just preliminary imaging. These are all murine mammary gland tissue and murine kidney tissue. So on the left, in A and C, this is going to be your silane standard for mammary tissue. And the top you can see is 40X. The hematoxylin and eosin staining, this is what it looks like. This is our standard. This is what we're comparing everything to. And at 40X, you can see the adipocytes and the vasculature in the tissue. And then for C, if you zoom in at 400X magnification, that's also mammary gland tissue. In comparison to group D, which is our lemon oil, you can see that there is good staining as well. You can see the pink and the purple fine. And then you can also see the adipocytes at 400X magnification, and those are comparable as well. It looks a little more bubbly here, I would say, because maybe the tissue was cut a little thicker, but it appears that the staining was fine and you're able to, the dye caught and there's no blurriness. On the right side, for B, D, F, and H, those are going to be your kidney tissues. Yes, your kidney tissue. So for B and F, we focus on looking at the tubules at 100X magnification, and then we also zoomed at 400X for both sides, and they do look comparable. So our conclusion and future directions, results for experimental group D that used lemon oil for both the deparaffinization and clearing steps yielded comparable quality of the staining in cytoplasmic morphology, uniformity, and clarity when compared to the silane control group A. And that's going to be our point of reference is our group A because it's using silane and silane. Connective tissue and epithelial tissue were present in all tissue types and stained well in group D. And that's kind of the focus here to see if it's applicable to all tissue types. Lemon oil has the potential to be a biofriendly alternative to silane in histological processing and H&E staining. The future directions for this project would be to expand on using other different types of tissue, and not just mammary gland, mammary tissue or kidney tissue. Expanding to more muscle tissues, liver tissues, different types of organs would help kind of solidify the fact that lemon oil is a comparable alternative to silane. And that concludes my presentation. I'm going to open it up for questions.
I have a question.
Okay, yes, go ahead, Andrea.
So this experiment is supposed to help with kidney failure?
No.
Or just kidney disease in general?
So the focus of this experiment is to find an alternative to silane. And silane is used in 2 steps of staining tissues. The deparaffinization step and clearing steps. This type of research would be applicable to pathology and specifically taking tissue biopsies and trying to have pathologists determine the pathology of the tissue. So it would be applicable to just kidney tissue, but also branching out to mammary tissue as well. So just tissue staining in general, not just kidney failure or anything like that. Does that answer your question?
Yes, it does. Thank you.
Mm-hmm. Yes. Like Dr. Visbal wants to clarify for diagnostic steps and not treatment. Yes, this is definitely for diagnostic. Thank you, Raina. Yes, the staining is most commonly used stain for diagnosis of cancers and other malignancies. Thank you, Dr. Bisbal.
They did this as part of a class, not even extended research. So fantastic work.
Yeah, that's a really good job.
I'm gonna head out and visit some other posters, Taylor. Great job. Keep recording, and you have a little bit more time to keep presenting. So I'll see you later.
Yes, thank you, Dr. Bisbal.
Yeah, thank you so much. It was a good presentation.
Thank you, Andrea.